लाइव है क्या अभी?
हाँ सर, हाँ सर।
ओके ओके। मैं और मेरा स्क्रीन शेयर करना है क्या, और पहले कुछ कर रहा है?
Good afternoon, one and all. Myself, Dr. Krisha Kadakya. I am a representative of MediUse. Just to start with a brief introduction to MediUse, MediUse is basically an organization where we conduct various webinars, we conduct various programs, we conduct hands-on workshops of all the faculties, including dentistry, Ayurveda, homeopathy, and all these faculties. So basically, herein we have an approach to help the doctors. Medius is made by the doctors for the doctors. Recently, we have conducted an event called the award show of excellence in dentistry. The excellence in dentistry was blessed by the presence of the governor, as well as we had amazing guest list on the platter at the award show. And we have also conducted various hands-on workshop in TRP and live webinars on how to crack Neet PG exams. So hereby we present you another live webinar in which we have Dr. Vignesh Nair with us right now, who is an endodontist from Government Dental College and Hospital, Mumbai. And he will be guiding us on how to prepare for NEET MDS exams. I will now request Vignesh sir to speak a few words and then continue with the presentation.
Hi. Thank you so much, Team Medi Ayush, for inviting me to give this lecture. So it's my pleasure to share my little experience with you guys. So shall I go on and share my screen?
Yes, sir. Sure.
So is my screen visible now?
Yes, sir.
So, yeah. So, I'm starting. Yeah, I'm Dr. Vignesh. I'm basically from Kerala. I did my UG from Amrita School of Dentistry, Kochi. And after that, I joined Government Dental College, Mumbai for my MDS. So, this webinar will be a very informal webinar with contents and a little of personal life, which I went through as an intern, as a student, and during my PG preparation days. So we can start. And this webinar, I would like to thank my HOD and my Dean, Dimple Padave ma'am and Dr. Abrar sir, for giving me permission to do this. And this webinar is actually a tribute to my mentor, my guide, my everything, Dr. Raisin sir. He is the founder of CD's entrance coaching, and he was the one who has molded me and prepared me to give my NEET, to achieve a great rank, and to get a admission for MDS in GDC Mumbai, which is one of the prestigious dental colleges in the country, and that too in my favorite field, Conservative Dentistry and Endodontics. Thank you so much, sir. So in this presentation, I'll go through my story. I'll take you through my UG days, through my preparation days, and my strategies for cracking the NEET. So these are some pictures from my UG days. You can see we had a lot of fun, and we did no studies regarding NEET in this time. So we were actually enjoying the internship and UG days. I was just a very average, or you can say below average student. I just managed to pass every year. That was the only thing that I can tell you. So in internship, what I actually did was like we enjoyed full time in the college. We explored different places which were nearby the college, and we participated in a lot of activities. Since our college was a charitable organization, so we had a lot of camps, a lot of activities around. And while doing all these things, I was little serious during internship, and I got to know a little bit about the scope of each branch of dentistry. So, and then I narrowed my choice to the Department of Restorative Dentistry and Endodontics, and I made my clinical skills a little better. In each posting, I got to do like different things with the help of my great staff in those departments. So I was a little confident in the clinical side, but not at all on the theory side. So once internship got over, Zameen pe aaya. Okay, then the question that every one of us face, what to do. So my options after internships were like everyone. My first option was to go abroad. So, and the second option was is to work under someone, and the other one was the doing an MDS, which was the last option. So I had encountered different problems in these three options. First, when I considered about going abroad, then I couldn't fund myself, and I did not want to depend a lot on my parents. Since I did my UG from a private college, I had already burdened them with a lot of financial things, so I did not want to burden them again. And the second thing is work under someone. So as you all know, if you in India, if you work under someone, they're very low pay. Some people don't pay you at all, and some people pay less than 10,000 or maximum 15,000 rupees for a month, which is not good. And the last option was to do MDS in a government dental college, so that the fees is less and we get a stipend. But the problem was I was just an average or below average, just passing guy. So it was out of my dreams. So why MDS? Many people do MDS because everybody tells you to do MDS. Some people have passion towards a separate department, to dentistry, and those people do. And some people think it's having a financial freedom, which I don't think so for a great amount of people, but a lot of people get good returns after doing MDS. My reason of choosing of doing MDS was because of this. She is Dr. Mugdha. She is my girlfriend from first year of BDS. So we when the internship got over, we had to do something to get married. So we were asking her parents or my parents. And when I approached her parents, her dad was tell, start earning and then we'll see. So I was searching for some jugaad. So I found this. Then I went to my dad, asked him, and my dad was like, you start earning, otherwise I'll not ask. I have some respect in the society. I cannot ask like that. So I was like, this was really my thing. But keeping all this aside, kindly note, I am not a supporter or a hater of any political party. All the images shown here are for only demonstration purpose, nothing more than that. Now we can come to the status of government dental colleges, coming to the topic. So there are around 60 government dental colleges in the country, which has around 900 MDS seats. So in this, the competition you face is from 20,000 to 30,000 students. And among these, less than 10,000 of the students are serious aspirants. And Baki sab faltu log hai, they just give the exam for giving the exam, as I did in my first attempt. So coming to the MDS preparation. So immediately after internship, I joined series coaching center in Davangere. So this is the classroom. So you can see the pressure that I felt in this classroom. There was not even a space to stand. So it was completely packed, and the same center has 3 floors, and 3 floors have the same amount of people sitting over there. And they have a lot of satellite centers throughout the country, which has similar amount of people sitting over there. So when I entered there, when sir started with anatomy and oral pathology, so when I was sitting there, when sir just starts the lecture, everyone starts shouting the answer to the questions he told. I was just totally depressed by hearing all these things, and I was like, I cannot do this. That was the condition that I faced. So reasons I have met sir, he was like, give it a try. Initially, everyone feels the same. So after some time, you will improve, you will get to study, you will be in the flow, and you can do it. And he did a lot of motivation to me, for me, and that made me like a little stronger. And you can see this is my study room. This was after the Neet exam, when we were vacating the room. This was my table, and you can see a lot of stuff over here and there. So this and initial in the PG preparation days, I did not know anything when I was joining there. So I used to spend a lot of time studying. I studied around 15-16 hours, or some days 17 hours initial days, not throughout the year. So initial days, so that I could cope myself with the extremely talented people who were sitting next to me. So after the first 2 to 3 months, I was having a little grip of the subjects, and I was following the institutes, because they had every week they had tests, they had online tests, they had summative tests. So I was just following the sir's coaching, and I was just going like that. And this is the same thing, table. And how did I prepare? So this is my strategy. So I am dividing this into 3. In the reality, there are 19 subjects for MDS exam, which I had time of 7 to 8 months. And I was totally new to all these subjects. Other than the previously asked questions in the BDS final year exams, I did not know anything. That was just studied to pass the exam. I did not know any basics. I was very weak. So I was completely new to all these subjects. And coming to the second, this is the resources. So in MDS preparation, we can divide the resources into 3 types. The one is the basic books, which are the basic standard textbooks of the 19 subjects. And then the most important thing is the previous year's question papers, so that you can understand which type of question comes from which topic. So we can focus on that area clearly, and then we can make maximum use of the study time. So, and then wherever coaching you go, there'll be having some additional books for some subjects. Some subjects will be given more better in some other textbooks, so we have to refer for those. We have to check for those books. And then coming to the practice part, which is entirely in our hands. So we had in our institute, we had weekly mock tests, which were online. So we used to give weekly mock tests, and every mock test in 2 to 3 days, the rank list will come, our scores will come. So we can grade ourselves, how we are preparing. Is it going in the right direction, or do we have to do something more, or something we can understand? And then we have 4 subjects text, because after 4 weeks or after 2 months, we'll have an exam which covers 4 subjects. And then after 2 to 3 months, we'll have the 8 subjects which were covered. We'll give another exam. So we'll be revising all the subjects, and we'll be practicing at a more larger. And then we'll go to a 12 subjects test, and then we give mock exams. Once everything is done, nearing the exam, 2 to 3 months before the exam, once entire subjects are covered, you can give full-length test series with a simulated environment, like you are sitting for the Neet final exam. So you're sitting in the room, you are getting the question paper, solving the exam with the same conditions as the exam. And you can give full-length test series. So in the last 2 months, I did maximum of the time I was doing full length test series. And then the main point in any entrance exam or any exam is the revision. Because once the studying is done, we are humans, we are not robots. Once we study something, we'll forget. So we have to revise it. So every subject, whenever you study something, you'll understand. Then you memorize it. Little bit you memorize, and then after 1 week or something, you just get back to that, just see, then you'll understand half of the things you forgot. And the basic books in dental entrance or MDS exam are Dental Pulse, or some people use Dentist. So these two books are almost the same, but the way of presentation is different. And in dental, and almost all the previous year question papers, they have categorically sorted these questions into different sections of each subject, so that if we study one section, we can do that questions from that book. And if we complete one subject, we can complete this subject from that book. So like that, and this, I have done this today. Today, I had a lecture on this topic, and let's say today I had a lecture on anatomy. So today I am studying anatomy, and once I study, I just look at the questions which came from that topic of anatomy, and then I'll study that, and then I'll just make, in my thing, I wanted to make notes. I could not study everything directly from the textbooks, so I understand, and then I make small notes in my own words. So I'll make a small note, and then I'll go to the question. So first I'll take in our coaching center, or in any coaching center, once the class is over, they'll give a question paper, and they'll solve the question paper in the class. So, and every question will be different, and the instructor will give you additional points for those topics. So we'll compile those questions into the notebook. So once these things are done, our note is ready. Then comes revision. So in every week, we have to keep maximum 2 days for revision, and coming to the end, nearing to the exam, we'll have to keep this more often. Like half of the week you have to keep for revision, half of the days for studies. And in the last 2 months, there is only revision, because every subject is covered. So we have to revise it again and again and again. So there are people who have revised the Pulse, which is that big book. The Pulse book, many people have revised it 15 to 20 times. So whatever it comes from the Pulse, you have to make it right, because if you don't make that question right, that's a blunder. If the recent trends in the exams are like, they're asking a lot of medical questions. So in those medical questions, if the same question comes to me, comes to you, we both find it difficult. It's not easy for me, or it's not difficult for me. It's like similar to everyone. So those questions won't matter. But the questions that are simple, which are like readily seen in front of our eyes, in our Pulse, in our institute papers, or in the textbooks, direct questions from those questions, if you make those incorrect, that will be a problem for in the exam. So once all these things are done properly, then the way to GDC is confirmed. So this is my GDC. This is GDC Mumbai, which has given me a lot. And this PG preparation and the success of this PG preparation gave me a seat to GDC. And the additional thing and the most important thing that came with the Neet result was my marriage to my girlfriend Mugdha. Okay, so some of the commonly asked questions, like how many hours do you study? So for this question, that is different for everyone. So for some people, they study a lot. They can study a lot. For people like me, I cannot study for a long time. On a long stretch, I cannot sit idle like that. So I'll take breaks in between. So like ideally speaking, you have to study around 7 to 8 hours a day. If you are fully preparing, if you are doing internship and then you are preparing, then you should devote at least 4 hours of your time towards preparation. Because the other people who are preparing only for Neet, like spends 8 to 12 hours. So you have to at least spend 4 hours if you are in internship. So how to revise? How to revise is also like I'll tell my strategy. So whenever the subject is going, like if this week I am having classes of anatomy and oral pathology, so I'll study whenever the class is there. I'll study those subjects in that time, and then the rest of the time I'll just revise whatever I studied the previous. After 2 to 3 months, there are many subjects. There will be many subjects. So I'll just designate some days for revision, and for those days I'll just tell that on this day I'm studying biochemistry, on this day I'm studying physiology. Like that, I'll define specific days. So you can also do like Monday to Sunday you have time. So you can you can keep Saturday and Sunday for revision, and the rest of the days you can study in the initial time. And for Saturday and Sunday, don't study anything new. So you can just keep revising whatever you have studied on the previous days or previous month. Like that, you can study. And another question is, can I study by myself or do I need a coaching? This is also a matter of personally it differs. So for a person like me, I was not an ideal student. I was not a very, I cannot put myself into pressure. So I had to make someone work. I wanted someone to make me work actually. So I joined a coaching center. So the coaching center has different advantages. Like they will have a system. So they'll have different lectures on this day. They have a mock test. They have everything will be planned. So we don't have to put our head into that. Otherwise, we'll have to make these things ourselves, which is like time consuming. We only have less time. We have a lot to study. We have to read. We have to make notes. We have to do questions. We have to do a lot of things. So with all these things, I did not find myself capable of making a timetable, following that. So I wanted someone to do that for me. That is why I joined a coaching center. So if you are confident that you can design and you can study in a very religious manner, then you need not do any coaching. But for guys like me, we need coaching. So, and I had a lot of support system. This is my family, and this is my best friend Ashwin, and this is Mugda's family. This was immediately after exam. We went to a house. My dad was very happy. He asked for Mugda, and everything went fine. This was my support system in Davangere. You can see Appaji, you can see Suraj, Kevin, and Ravina. All these were friends in Davangere. These were the people who kept me alive during my Davangere days. I did not go home for the entire 7 to 8 months. I was only in Davangere with these people. So they took the most out of me, and I took the most out of them. And these three people are having a commendable role in my PG preparation days. This is Dr. Faraj Mohammed. He was All India rank 1 in the first Neet exam. And this is my batchmate Annapurni. She got GDC Chennai Endo. And this is Ashwini. Dr. Ashwini was my teacher. Actually, in one stage, she taught me. And these three people were my guiding forces, along with Raisin sir, throughout my PG preparation days. Because of them, I could keep me motivated, and I could accomplish what I've accomplished. And I owe a lot to the teachers at Amrita School of Dentistry, my UG college, which was in Kochi, Kerala. And now is ready for some show time. Once you get to GDC, once you get a good department with great people around to teach you, I was very fortunate to have Dr. Abrar sir as my guide. He gave me full free hand to do whatever I wanted. If I did the research, if I did the study for that thing. If I was prepared, he was giving me full free hand. So you can see this. This is the PG life in summary. I was very fortunate to have a lot of patients who were very cooperative, and we did a lot of good things to them, and they were very grateful for that. And I thank God Almighty for all His blessings. So next we can talk about something about how to design in another webinar or something. We can how to decide a branch, how to choose a college, how to make maximum or the most out of your PG. And thank you so very much. And I am a very hardcore fan of rubber dam. That's why the slide. So that's all. My presentation ends there. So now we can take questions from Dr. Krisha. So I think she has collected some questions, or we have questions from the audience. So we can just go for that. Thank you so very much.
That was a really amazing presentation by Dr. Vignesh sir. The presentation was really captivating, and I guess it might have answered most of our questions that we as aspirants might have while preparing for Neet PG exams. However, I would still like to request all the viewers to put their questions in the live chat in the YouTube live, so that we can answer those questions. In the meanwhile, we have collected some previous questions from various sources, and I would be starting with those questions shortly. Okay. So may I start with the questions now?
Yes. Shubham is there.
Okay. Okay. So
was I clear?
how essential? Oh, okay. Yes. So how essential were the initial first 4 years in the entire NEET preparation scenario?
Yeah, that's a very important question. Actually, if you are a very good student, if you are religiously prepared, if you're religiously studying all the subjects during the first 4 years of BDS, you need not study. Like I said, I had to spend 16 to 17 hours a day, because those people would need only 2 to 3 hours, maximum 4 hours to study. So if they are very good in studies, they can keep those time. In the PG preparation time, they'll be having they'll have to dedicate very little time to achieve the same result. So that's the main thing.
Oh, yes, sir. I completely agree with this. The next question would be that there are, while preparation is going on, there are many lows and downs. Was there anything that was constantly motivating you? Like at times we have an idol, at times we have a favorite quote. So did you have any such factor which constantly kept on motivating you?
Yeah, I even had lows on the same day. In the morning, I was happy. Afternoon, I was very depressed, very down. But the main thing that motivated me was, I told you in the presentation, was the problem with the families. I had a girlfriend, so that was one of the most motivating factor for me. Many people will have other things. And another thing is Cristiano Ronaldo. He was a very big motivating factor for me. Whenever I see motivation or hard work or talent or whatever, I'll just see, I just look forward to Cristiano Ronaldo a role model. That's it. So how to tackle tackle it? Everybody will have lows. Today I am having a low. Tomorrow my friend will have a low. So nobody will be having always high. Otherwise they will have to be taking something else. Otherwise they'll not keep all time high. And this is normal for a lot of people. So it does not matter if you are low on one day. The next day you can, if my strategy when I am very low is just close all the books, I just sleep. The next day I wake up, I know that yesterday I was down, I was wasting a lot of time. So today I have to stop all these things, I have to study. So next then my motivation will be that. So it can keep me motivated like that. And reason, sir, that is the main motivation factor which we all had in Davangere. Every single day, whenever a lot of people are depressed, he'll send a voice message in the group, which keeps us motivated for the 1 or 2 weeks. So this motivation, one problem with motivation is like motivation is only a temporary thing. So today I am feeling motivated, so next day I may not. Otherwise I need something to get my dopamine high. So for those things, now the best thing is to set a discipline. So in my case, I was a night studier. Like I was a night owl. Like I studied till 3 a.m. But I used to wake up at 9, 10 a.m. Okay, so I used to like sleep very late and get up very late. Okay, so that was my thing. So you can like define your thing, and you have to set times for study, set time to eat. So those times you just do that. So that keeps you motivated, or मतलब, it can give the maximum out of you rather than depending on motivation.
Okay, sir. So before continuing with further questions, I would like to announce one thing. Just as Vignesh sir was a Neet topper, he's also a really passionate endodontist as well as a passionate teacher too. So we will be having various hands-on sessions and webinars on endodontics with Dr. Vignesh Nair, which will be announced on the Instagram page or as well as on the YouTube live or the YouTube videos. Along with it, we will also be conducting various webinars on topics like fixed orthodontics and orthodontics, implants, suturing, and all these things will be conducted. Do remain in touch with the Instagram page of MediUse, which will soon be shared on the live chat of this YouTube session, as well as you can subscribe to the YouTube channel to be constantly in touch with the updates of the various events, webinars, and the award ceremony or any such events which will be conducted by the Med. So continuing with the question and answer session, I would now like to ask that how did you keep your distractions away from it?
The same, like distractions.
If you had any.
Yeah, we had a lot of distractions because whenever we are, like I was in Davangere, which was a totally new place to me. So I was having no friends actually, like except from my close ones. I did not have a lot of friends over there, and the distractions as a part, like my mind was deviated to a lot of things. I was thinking about the family thing, what will happen if I don't clear. All those things were my distractions. So those things, like I could not get rid of them completely. I had to live with them, actually speaking. So like whenever I was thinking like if I am not cracking this exam, I'll not like able to continue my this thing, that thing, mukda matter, all those things. So I had to be like, I have to push myself. If I'm not doing, that's not the thing. I have to do it. That was my motivation, which kept me away from a little distraction. And whenever I had some distractions or had these things, I had these friends, very close ones near me, so that I could share these things with them, and they used to motivate me. I used to motivate them, and and all of us are in good places right now. So we are grateful for that.
That is great to hear, sir. Apart from that, what I would like to ask is that those students who are doing their preparation along with internships, they are constantly in that dilemma whether I should focus on clinical practice or should I sacrifice clinical practice to focus on the exams. So, any advice to those students from
Yes.
your side?
So like this is also a very commonly asked question. So in this you have to fix your thing. Like for a person, we have to fix what are we gonna do in the future. So if you know that you are gonna set up a clinic, you know everything, you decided pehle se, then you know the thing. You're not gonna prepare. So those people can directly cross this and directly focus on their clinical skills. If they are having 100% confidence and they have in their village there is no dental clinic. So if he starts a clinic, he'll be the number one dentist, he'll earn a lot of money, and if he is not interested to study. For those people, everything is on one side. So he can directly focus entirely on his clinical skills. Like in internship, in endo posting, he can learn basic root canals, In surgical portion, he can learn a lot of extractions, like how to extract a firm tooth, and some easy mesioangular or horizontal impactions he can do in surgery. And in prosto, he has to learn crown cutting to the tooth preparation. So all those things are basic things if you are starting your own practice. Otherwise, nowadays you can see, like, the people who are not doing all these things in internship, they are paying huge amount of money for courses which are conducted outside the college. Even when they had like opportunity to study all these things free of cost in their college, they are spending a lot of money on these things outside. So people should, if their intentions are very clear, they have to focus very clearly on the internship, the clinical part. I was such a person and I used my internship to that extent. But for the people who know, I am not satisfied with studying, I want to do an MDS. But those people also, I am not telling that they have to completely sideline the clinical part. They also have to do clinical part, because the Neet, rank and everything is like, it's not like a predictable thing. Sometimes you may get, sometimes you may not get. There are very close friends of mine who are more hardworking than me, more talented than me. They were toppers in the batch who could not clear Neet. So those people should have a clinical side. They should not eliminate a clinical part entirely. They should have their focus on clinical, but they have to dedicate 4 to 5 hours every day for this. Most of the colleges will be over by 4 or 5 o'clock. So after that, till 4 o'clock, do patients, do your clinical part very well. And once you're done from the college, no need to time pass nahi karna hai. You just go, sit and study. If they want to really study, that's it.
Yes, sir, definitely. The next question would be, do you believe in the concept of group studies? Or do you think that group studies are essential to ace the exam?
Group studies are also like very like controversial topic, but for some people group studies are very effective. For me, group studies are very effective. Like, I am studying one topic, my friend is studying another topic. So when we discuss, my topics will be I can make the other person understand my topic, and he can make me understand his topic. So my learning of the new topic will be very easier. But the group study has a problem. If the people in group studies, it can range from 2 people to 7, 8 people. So if multiple people are involved, then the group study will become a gossip session. Then the people will not talk about studies, they'll talk about different things. That will be useless. So if you are doing group study, you have to make a group of maximum 3 people, 2 to 3 people, and you should be like, those 3 people should be like a little serious aspirants. Otherwise, you can, like, one person like me, if he is like a little lazy fellow, the other 2 people can motivate me to study harder. So that is also an advantage of group sessions. So that's the thing.
Right, sir. The next question would be, at times there are people who cannot focus on subjects that they don't like really. So how would you suggest to approach those subjects?
Yeah, for me, this was prosto. So I never liked to read prosto. I used to love prosto works. I used to love treating like complete dentures, everything. Now I used to love working like prosto working part. But when I take the prosto book, I just leap off. That was my situation with prosto. So I had to believe that I had to study prosto. For this, I relied on group studies. 2 of my friends were very good in prosto. They love to read prosto and live prosto. So those people motivated me, and those people taught me prosto actually. And Raisin sir is also a very hardcore prosto enthusiast. Like, he just keeps everyone prostoholic. So like, the prosto was like a very hyped subject at my time. So those things motivated me to study prosto, at least for the exam. And immediately after the exam, I just closed all the prosto books and kept on the side. So that's the thing. So you have to find something or the other, because you cannot leave that subjects. That's a clinical subject. And if you go for an INICET, the AIMS exam which we had, so those exams are more focused on clinical subjects. So in those times, the prosto as a clinical subject is important. And now also in Neet also there is 2 parts. One is a clinical part. That clinical part needs prosto. So you cannot avoid. I don't like prosto. So that doesn't mean that I cannot leave prosto. So I have to find either other motivation and do the study. That's it.
Absolutely, sir. I agree with this totally. Apart from that, we have a question in the chat box that how important are the memory questions?
Pardon?
Memory-based questions.
Memory based questions.
Memory-based
Yeah.
questions.
Yeah, understood. Memory based questions are basically of author's name, dates, and fixed universal truth statements, like universal questions will be there. So those questions will be given in Pulse, Dentist, or almost every books will have them. So when I told about revision, like people revise that entire Pulse for 15-20 times. Like the people who are entirely focusing on Neet will prepare minimum they'll revise 15 times the Pulse book. So when we revise the same question over 15 times, that already whenever that question comes, the photographic memory will directly ask us to mark this. So those questions we will have to make it right if we have seen it. But if a entirely new concept comes, nobody knows that. Better to leave that question, not to take not to take the risk, because these questions will not have the logic with them. So we cannot logically write the answer if we don't know that. So that's it.
Right, sir. So since you said these questions do not have logic, so what about those questions that are based on conceptually oriented questions?
Yeah.
Those questions are more or less seen more often in INI-CET or the AIMS exam.
Yeah.
So how would you suggest to deal with those kind of questions?
Those questions are entirely depending on your preparation. So when you prepare, you have to make your concepts really clear. So in those questions are the real questions actually. So if the memory based questions, who has better memory will perform well. So these questions trick you. These questions makes you think what is the answer, because you have not seen that question before. So if you keep your concepts really clear and you attempt such, there are papers there if you don't have, in India INSED started only 3 to 4 years, so you will not have much questions on that. Then you can take some books from USMLE, the dental exam, and NBD textbooks are there. So those textbooks may entirely you have such type of questions. So you can attempt those questions. Okay, so that you will be familiar with those type of questions. So in my case, master dentistry, a book is there, which is used for not the mastering BDS, not that. Mastering dentistry is a book for UK dental exams, and NBD one textbook was there. So I use these two textbooks for these concepts based questions. So whenever clinical subjects comes, you take that book, like I try to solve it. It will be difficult, but once your concepts are clear, it may become easier after some time.
Yes, sir. And what is the importance of reading synopsis samples?
That's a very good thing at the end. When you don't have time to revise anything, the Pulse synopsis will be hardly 2 to 3 pages per subject. So at the end, if you don't have any time, you can read the synopsis just before the exams, and in the synopsis also you can mark and highlight and keep everything, so that whenever like you don't have time, you just go through those pages. But if you only depend on the synopsis, it doesn't make sense. So what I did in my preparation time in Pulse, the Pulse was my main book. So whatever information I get from the other books, I told about NBD textbooks. So whatever new points I get from those textbooks, I just write it on my Pulse books. So, and in my Pulse books, it will be a accumulation of everything I have read. So I don't have multiple books. When I'm studying, I am having 10 books. But once that is done, everything will be confined to the Pulse. So in the last revision, I only have the Pulse with multiple information in that. So the revision will be faster. If you have 10 books, you cannot revise it very fast like that.
Okay, sir. Sir, I would like to request you to give a bit of information on some of your upcoming workshops with Medi.
Yeah, like we'll think about it. I am a very hardcore fan of rubber dam, so which is one of the most important things. So we'll plan for some rubber dam courses or some basic endo courses for the people who have not had a hands-on on endo. All those things we'll think about it and we'll plan accordingly.
Yes, sir. Certainly. I would now request to the participants if they have any questions, please do put it in the chat box. Okay, so sir, we have one more question. One more question. How to approach medical subjects, especially general medicine and general surgery?
That's a very big thing because now we have to consider medical subject as medical subject, because now we are giving dental exams, but medical subject is a necessity in our subjects. So we should not devote a lot of time studying medical subjects, because once you start general medicine you will not finish general medicine. The medical people are studying for 5 years entirely on those things. We are not designed for that, and we are not going to do that. So we should limit ourselves. Like we have, for my thing, the funda was very clear. Previous year questions, basics of all the systems. So when your microbiome, physiology, biochemistry, all those things are strong, like if the basic concepts are strong, then you can logically guess the answer for the general medicine questions. So I did not spend a lot of time studying general medicine as a separate subject. I used to correlate the other subjects and do the general medicine preparation.
Okay, sir. Any other questions from any other viewer? Okay, sir. So I guess we don't have any other questions in the chat box. And I believe that this session would have really helped all the aspirants. I certainly believe that sir has given his best in conducting this session, and most of the questions have been answered, which would be there in the mind of a Neet PG aspirant. So I would now request sir to conclude this session with a leaving note, and do keep in touch with our YouTube sessions. So for more such webinars, for more such live events, yes, sir. Will you please conclude the event?
This was like one of the first webinars actually were conducted, and this was like a very new thing to me. And the most important part was like I was not seeing myself when the presentation was going on, so I was just talking to the screen. So but it was a good experience, and I think some people may have got something from this. And if they have any doubts or clarifications, they can contact the Meduse team directly, or they can contact me. So I am very happy to help them out. So, and another thing is this is a great initiative by the team Meduse. Shubham was my junior. He has done a very good job creating this Meduse. Even Krisha is from GDC. Many people, the people who are running behind the scenes are mostly my colleagues. So it was a very comfortable interacting with them, and giving this lecture was very it was like a butter. I was not effortlessly, I was just speaking, I was presenting. I just made the slides day before yesterday. That's it. So it was a good thing, good experience, and I think that it would have helped someone. So I'm really glad that I have got this invitation and I had done this. Thank you so much.
Pleasure is all ours too, sir. So I would now request to end the Google Meet, and do stay in touch for further updates. Thank you.
Thank you.